Hello class, this is your week 5 lecture. This will not be terribly long, so giving you just a little bit of a break, but I want to touch on this topic and define it for you. Oh, and I've already got a typo. I'm so tired, guys. Alright, it's not positive and negative rights, it is positive and negative rights. Anyway, I'm just apologizing in advance for my typos. But this won't take too long because these are relatively simple concepts. It's just that sometimes learning what the examples of them are can be somewhat difficult. And it can also be a contentious issue, especially in American politics. The definition of positive and negative rights and whether or not they are human rights is actually one of the defining things that differentiates what you would call conservative-leaning from liberal-leaning voters and politicians. So though these could potentially all fall under the scope of human rights, but those who lean conservative would in fact say, no, just negative rights are human rights, and those who lean liberal would say, well, in fact, yes, negative rights are, but also positive rights should be considered human rights as well. So let's look at the examples of these. Negative rights can most easily be thought of as an inaction by the authority. Of course, for our cases, the government is going to be the authority that we're primarily talking about. This means that the government doesn't get in the way of your activities. In other words, you have a right to do certain things and no one has the right to infringe on those activities. It's the government getting out of your business. This allows access to something that you may need or something that may be necessary to your well-being without any interference. Some examples that we're fairly familiar with would be freedom of speech. So you can dissent from the current government. I don't think a lot of Americans realize, in fact, quite how rare that is. It is certainly the dominant philosophy in Europe and North America, but in much of the world, it is in fact illegal to dissent with the authorities that exist. There can be legal repercussions for doing so. And so that freedom of speech is in essence the government stepping away, getting out of the way of your right to say what you think. Now, another example would be the freedom to live. So the government doesn't tell you what to do for a living. It doesn't kill you, obviously. That you do have that right for your government not to kill you. And another negative right would be the right to privacy, or the right to be left alone, the right to not have government intruding into your affairs, into your business, and keeping tabs on you, in essence. But that can also apply, and here's where it gets a little sticky with negative rights. All of these rights can also apply to your fellow citizens. So the bar for negative rights needs to expand a little bit to the point where we acknowledge that the political authority that exists protects our negative rights from other citizens by potentially getting involved. So your freedom to live might be protected by the government putting in jail someone who has attempted to kill you or rob you, or it may protect your right to privacy by passing laws that certain people cannot take photos of you in your home without your consent, or that people cannot hack into your accounts and read your emails. Those kinds of things are protected by the government, even though they are considered negative rights. So we have to acknowledge within negative rights, there is in fact still a role for government to play in protecting those. Now, positive rights actually require an action or a protection by the authority. Okay? This is where the government would step in to assure the safety and well-being of citizens. Instead of just leaving them to their presumed safety and well-being, the government takes an active role in assuring that there is safety and well-being. This might mean giving access to a need through provision of a service or an entitlement, An example might be police protection, right? So I just mentioned that the negative rights has to expand into the positive right to the point where we actually do have law enforcement to protect citizens from each other. This is a service provided by government. Another might be access to clean water. You assume, in the United States at least, that when you turn on the tap, you're accessing safe water. That safe water is overseen by the EPA and by different government bodies who make sure that you are not going to be put in danger by it. Now, of course, that immediately brings to mind Flint, Michigan for most of us, where there is a high toxicity of lead in the water because there were errors made. And it's a little, I won't comment on that to a great extent because I'm not an expert on that case. So I don't know to what extent the errors, there were errors of honest mistakes, where there was incompetence and where there was an actual intentional wrongdoing. So what the main point to take away from that is that clearly government did not do its job in Flint, Michigan, especially in ensuring positive rights. Another example that might be a positive right that the government has to enforce is protection against labor abuse. This means someone forcing you into slavery, someone not paying you or underpaying you, not paying what they promised to pay you. I've actually had to report 2 employers to the Department of Labor because they, in fact, did not honor our contractual agreement. They underpaid me what they said they were hiring me for. I got reparations in both situations because the government, the Department of Labor, stepped in and corrected that situation. You can be protected from assault by your employer or coercion of any kind to force you to do labor. You should be able to leave work at will if it's not actually slavery. The government also protects you from unsafe conditions in a labor environment. So they ensure that wherever place you are employed, there aren't so many economic corners cut, there aren't so many choices made that you are, in fact, endangering yourself by working in those conditions. So this is your basic breakdown of the negative and positive rights differential. Now we get into some of the nitty-gritty examples. I'm only going to go to a couple of them here because I think you can extrapolate from this, and I don't want to lecture forever. I'm tired, as I said. One of these questions revolves around water, okay? So Flint, Michigan is certainly an example of where we think that the government should have made sure that that water was safe and that it was not, in fact, poisoning people. Turned out that it was. But most of us pay for water that we believe the government has ensured to be potable. We don't pay a large amount, which is probably why you don't have protests in the streets about water, but we do pay water bills because in the United States, the consensus that has been arrived at is that we will pay for this as a service. But that is actually debatable, whether or not water, which is necessary to life, should be provided to citizens because of the fact that it is necessary to life. So this is the question. Is access to water a positive or negative right? And I should insert here, is access to free water a positive or negative right? Because we clearly have clean water that we pay for, but should we have clean water that we don't pay for? Here's some of the things to question. First of all, it's necessary for survival. It's required to live. So it meets the first requirement to be considered a human right. Now, if you were a survivalist and you went out into the wild and you went searching, you could probably, if you were really good at this, you could probably find some fresh, clean water to live without involving any kind of government agency. You could probably find a place somewhere in the world where if you go far enough out, you find water that you can access, that you can live on, independent of government involvement. However, most of us are not survivalists. Most of us live in cities where there are millions of people, and those millions of people pollute our water sources. So it's literally impossible for me to go anywhere within a walkable distance of my home and find a natural source of clean water that I need just to live. So this is the problem that we run into. We're living in a society, we're not isolationists or survivalists. And so on a practical level, the government provides the means of cleaning and dispensing and testing the water for drinking quality. But in the United States, at least, we still pay water bills. However, many countries within the United Nations have voted to say that free access to drinkable water is in fact a human right. Most of those countries are actually not even developed or first world countries. But they have acknowledged that because of extreme poverty, these people cannot actually pay for clean water access. Therefore, it has to be given to them, because if it is not, they will die, or at the very least, they will have incredible sickness. And I certainly have experienced that firsthand living in India. I got a bacterial infection. Not because I drank from the tap, I'm not that stupid, but just because everything is prepared with the water that is not sanitary. So, I have put a debate up in your discussions tab that asks this precise question. I want you to think about it. I'm not giving you answers here. I want you to think about, is water a positive or a negative right? Should we have to pay for this? Since it is essential to survival, maybe it is a human right and thereby should be government provided. However, if we involve the government, could that be the government getting in the way of us accessing water in a healthier way, in a way that is preferable? And does it diminish the value of water and the quality of water if there is no payment for it? So these are things to consider. Okay, the other thing, I'm not going to have this debate because I don't actually want to get you all into the nitty-gritty of the American healthcare debate. You can do that in your American politics class. This is not an American political course. So I will certainly give a nod to this as a major debate that's going on, but we won't dive deeply into it. And that is, of course, healthcare, and how and whether healthcare should be provided to citizens by government. Now, in the Universal Declaration of Human Rights, Article 25, here's the quote: "Everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, and necessary social services." So, encapsulated in this article, you have the main reason that the United States never ratified the Universal Declaration of Human Rights. Most countries have ratified it. They aren't necessarily following it all that well in some parts of the world, but they ratified it. And the United States did not ratify it, mostly because of the provision that healthcare is a human right. The United States says, no, it isn't. It should be provided by private industry. The government should not be involved. It will devalue healthcare and diminish the quality. So that was the situation for a long time. And then, of course, we had the Affordable Care Act under President Obama, which made certain forms of healthcare government provided and aimed to make health insurance more accessible to people who had difficulty affording it under traditional means. Now, in much of Europe, healthcare is provided. You have socialized medicine or government subsidized medicine, because it is seen as a right that is fundamental to survival. It can kind of go back to the water question. Do you need it to survive? Well, healthcare is a little more ambiguous. You don't need constant healthcare to survive. If you would quit smoking and eat healthy and jog occasionally, you'd probably do pretty well. But when something happens, when you are hit by a car, when a rabid animal bites you or something, should you be able to walk into a healthcare facility and know that you will receive the best care available without going bankrupt or without being turned away because you simply can't afford to pay it? The Universal Declaration of Human Rights said that's how it should be. the United States said, well, we just can't guarantee this. Now I'm going to play you a video which is in my mind a great way to approach this, because it is Rand Paul and Bernie Sanders, both senators, who are talking to healthcare professionals about whether or not healthcare should be a government-provided service. And the reason it's great that it's these two is because they are at complete opposite ends of the spectrum in terms of this negative and positive rights debate. Rand Paul is clearly very far to the right in terms of his views on negative rights are the only human rights, and Bernie Sanders is quite far to the left in terms of his view that the government should providing several social services in order to meet all of the positive rights that he considers to be human rights. Now, within listening to this discussion between the two of them, I want you to keep in mind something that I said at the very beginning of the semester when I was talking about economics and why I teach political economy as an element of this course. It's because every political decision you make, every decision you make in your life is a cost-benefit analysis. Every single one, okay? So everything you do, from the type of cereal you buy in the grocery store to who you will marry and everything like that, is a weight of what do I gain versus what do I give up, okay? And political economics is doing precisely that in a political environment. So what you will see coming forward in this healthcare debate is that question. All right, what are we giving up versus what are we gaining? Now, what I would like to remind you of here, if there is an ethical imperative, then there is no debate. There should be no debate over whether or not to do it. For example, slavery. Slavery might be an incredibly economically viable option. The efficacy might be there, and you, as a slave owner, might lose very little in order to gain a lot of profit. However, there is a clear ethical imperative not to own people. We took a while as a society getting there, but I think we're more or less all on board at this point. So you don't need to have the economic discussion at all. If it's a human right to not be owned, then you don't get to debate whether or not you get more profit through having slavery be endorsed by the government, okay? So that discussion is just no go. We don't need to discuss any further than knowing whether it's right or wrong. However, if it's ambiguous whether it is right or wrong, such as these positive and negative rights that we've been discussing, well, then you get into the political economics of it. You get into whether or not what it's costing the government to not provide health care is actually worthwhile. So listen to some of the points that are made here.
Many people in my own state believe that health care is a right, R-I-G-H-T, regardless of income, that every American has the right to the best quality health care that the system can offer regardless of income. That if you're a low-income kid, you're a wealthy kid, you have the same opportunity to access the healthcare system.
You have to realize what that implies. It's not an abstraction. I'm a physician. That means you have a right to come to my house and conscript me. It means you believe in slavery. It means that you're going to enslave not only me, but the janitor at my hospital, the person who cleans my office, the assistants who work in my office, the nurses. If you have a right to their services, basically once you imply a belief in a right to someone's services, do you have a right to plumbing? Do you have a right to water? Do you have a right to food? You're basically saying that you believe in slavery. You're saying you believe in taking and extracting from another person. Our founding documents were very clear about this. You have a right to pursue happiness, but there's no guarantee of physical comfort. There's no guarantee of concrete items. In order to give something concrete or someone service, you got to take it from someone. So there's an implied threat of force. Now, just because it's a noble thing to believe that we are obligated as Christians, we are obligated through the Hippocratic Oath. We have always done this. Since the beginning of modern medicine, we have always provided 100% access. I do it in exchange for privileges. I do it because I believe in the Hippocratic Oath, but my hospital also says to me, you can only operate in this hospital if you agree to see everyone coming through the emergency room. I always have. We have always treated. We have always had 100% access through our emergency room. Those were for emergencies. They're not the best place for primary care. We all agree with that.
Senator Paul and I have some slight philosophical differences. My profound question to Dr. Krause is, do you, as an employee at a federally qualified health center, consider yourself as a slave?
I love my job. I chose to work there. I do not feel like a slave. Thank you.
As you know, Vermont is moving toward a Medicare for all single-payer approach. Are you worried that if we consider healthcare as a right in the state of Vermont, that the St. Johnsbury Police Department in the middle of the night is going to break down your door and force you to treat a patient? Is this an immediate concern of yours?
No.
Okay, thank you. Provocative, interesting discussion. I want to thank mostly the panelists for being here. It is estimated today that 5 million seniors face the threat of hunger. 3 million seniors are at risk of hunger, and 1 million seniors go hungry because they cannot afford to buy food. But in some cases, it's not just money. In some cases, it's having the transportation to get to the store. In some cases, the ability to think through, when you're 85 or 90 and alone, what kind of food you need and how you purchase it. Persistent hunger and malnutrition leads to multiple chronic diseases, resulting in extended hospital stays and premature nursing home placements. There are some studies out there, not quite sure, about a significant percentage of seniors today who are in nursing homes who need not be in that expensive care if they had good nutrition and somebody visiting them on a regular basis. That seems to me to be pretty dumb.
Only in Washington can you spend $2 billion and claim that you're saving money. Here's the thought. Perhaps the $2 billion we spend on OAA, if we subsumed that into another program and didn't spend it, that might be saving money.
Believe that spending money actually saves money. And I think that is the kind of philosophy which results in us spending almost twice as much per person on health care as any other country on earth. Because we have millions of Americans who can't get to a doctor on time. Some of them die, some of them become very, very ill. They end up in the emergency room, they end up in the hospital at great cost, rather than making sure they have access to a doctor. Maybe it's the same reason why we have more people in jail than any other country on earth, including China, tied to the fact that we have the highest poverty rate among children of any other major country on earth. So the point is, and I think we have a bit of a difference here, I think Senator Franken has spoken to the fact that prevention, keeping people healthy, taking care of their needs at home, does actually save money. And that if you deny those resources, you're leaving a senior citizen home today alone, isolated, confused about medicine, not getting the nutrition they need. You know what happens to that person? That person collapses. That person ends up in an emergency home. That person ends up in a nursing home at much greater cost to the system.
We do have different opinions. You know, some of us believe more in the ability of government to cure problems, and some of us believe more in the ability of private charity to cure these problems. I guess what I still find curious is, though, that if we are saving money with the $2 billion we spend, perhaps we should give you $20 billion. Is there a limit? Well, where would we get to? How much money should we give you in order to save money? So if we spend federal money to save money, where is the limit? I think we could reach a point of absurdity. Thank you.
Seniors in this country who are dealing with food insecurity, who are not getting the nutrition that they need. My guess is that the government is wasting substantial sums of money by not taking care of those seniors who will end up in emergency rooms, in hospitals, and in nursing homes. So you asked that question, my answer is I don't want to see one senior in this country go hungry. It's the morally right thing to do. And from a fiscally conservative point of view, saving government money, in my view,
Okay, so there you have the basic breakdown of the discussion. I'm going to fix this while I've got it here. And the economics of the discussion. Now, like I said, if it's determined that healthcare is a human right, it is therefore morally incumbent upon the government to provide it, then the fiscal discussion and the economy of whether or not preventative care and providing health care actually saves the government money, that whole discussion doesn't have to happen. But, as of yet, the general American populace has not come to an agreement on whether or not that is a moral imperative, and so there is still room for the discussion of the cost-benefit analysis. So take this, please let me know if anything I said was unclear. Please do send me an email and participate in the debate on whether or not you think that water is a right or a privilege, and continue your reading. Thanks very much, and I'll check in with you later.